Hello and welcome to episode 86 of our Conversation to Connect Let's Get Real podcast, powered by Exceptional Connections. I'm Cyndi O'Neill-Dady, the founder and chief connector of Exceptional Connections since 2009. Our to connect today is with the amazing Dr. Jess Cicoria, joining us from Arlington, Washington. Welcome, Dr. Jess.
Thank you so much, Cyndi. I appreciate you having me.
Oh, I am so excited to be able to walk alongside you as we unpack how better personal health leads to better business and how entrepreneurs can support their health. It's so important right now
Mhm.
because without our health, what is it, right? We need that more than anything else.
Yeah, you can't pour from an empty cup. So,
Absolutely. We need to have a full cup to be able to bless and support others and do our best work out there.
mhm.
So before we dive into this conversation, I want to take a moment to introduce Dr. Jess Cicoria to our exceptional connectors who may not already know her. Dr. Jess is a family physician who values thoughtful and relationship-based care and has a strong focus on lifestyle medicine. She is passionate about taking the time to listen and helping patients feel truly known and supported. So important and so rare out there. So she founded Lucido, did I pronounce that
Yep,
correct?
yep, that's correct.
Lucido Family Medicine. So Lucido, I imagine, means light.
It does, yes, like clarity in healthcare, light, like bright, shining. So, all of the things that you want your healthcare to be, and referencing this inner light. So, helping to guide people toward health.
Beautiful. So, Lucido Family Medicine to create a more personal approach to healthcare through a direct primary care model that does not bill insurance. With longer visits, direct communication, and an emphasis on prevention, Lucido reflects her commitment to making healthcare, I want to say, personal again and strengthening community connection. So, Dr. Jess, before we jump into this topic,
Mhm.
give us a bit of a overview of your journey before we
Yeah,
kick off our talk.
sure. So, I'm originally from New York, so I'm not from Washington. So I've had quite the journey to get here. I did medical school in North Carolina at an osteopathic medical school. I trained in Puyallup in family medicine at East Pierce Family Med, and then eventually made my way up here to Arlington. Which I know not everybody's in this area, but basically north of Seattle. um, and I did that because I just like the area. There's lots of land. We have a little homestead. Um, but I basically was working as what's called a locums doctor. And so, if you're familiar with that, it's kind of like travel nursing, but travel doctoring. So, I was traveling to a rural hospital and working there after residency. And I was doing that most of the time, but I wanted to get back into primary care. And this was my dream to do it. So with direct primary care, which I'm sure we'll get into, that's I wanted to go into that. And so I started that practice here in Arlington.
Wow, I love hearing about your journey. And I what I want to really be able to dive into as to set the tone here for our conversation is you've built your practice around truly knowing your patients. When we had a conversation earlier, that's what I was left with is your heart and desire to really get to know your patients, to be able to support them. And that means more than 15 minutes, right?
Yes,
Um,
yeah.
so what inspired you to step away from traditional medicine and create something more personal?
Yeah. Um, Thank you for that question because this is like hugely important. And I actually think that um, a lot of primary care is going to move in this direction. Um, and just to thank you again for our conversation the other week, I really, really loved talking about this. For everybody listening, we spent like, I think it was 3 hours on the phone. So it was really fun, a fun conversation. So, why did I pick this model? So, when I was training in residency, residency is meant to be training that you see a high volume of people. They push you to your limit. You're trying to learn everything that you can possibly learn in 3 years. And with that comes learning how to do the practical part of doctoring, which is how to get through patient encounters quickly. Unfortunately, the system that we're in now, what we'll call traditional medicine, is if a primary doc works for a large company, um, insurance is paying that clinic to stay open. And the way that that clinic makes enough money to stay open is by seeing more people. And what that does is it takes the doctor's time and squishes it into about 15-minute visits. So in residency, I was able to do the see 20 patients a day and fit everybody into their 15 minutes. But even at that point, I was like, this is not for me, because I got into medicine to be able to talk to people and have relationships and get to know people, like what makes them tick, like why do they want to come to the doctor, like how can I help them. And the traditional model just doesn't support that. So this model, this is direct primary care. It's similar to concierge medicine, but basically it takes insurance out of the equation. And so that allows the doctor or the provider to have however much time they dictate. So it's based on what I feel is a good amount of time, which I'm a talker and I'm a listener. I like to do both. And so I do an hour-long appointment for each visit. And that gives people, like, honestly, I'm probably doing 15 minutes of medicine, and the rest of it is just getting to know people and hearing their story. And that helps guide what our treatment would be. Because if I'm hearing, like, yeah, I want to try all the medical things, then I know which direction to go. But if I'm hearing like, I know I don't want to do any medicine, then I'm going to tailor what I say to the person sitting in front of me. And I'm still going to give you the risks. I'm still going to give you the benefits, like, and we're going to discuss what my recommendations are and why they are. But it's so much better to have it in a longer conversation, because then we can understand each other. There's no rushing. There's no like, here's your medication and you're trying to tell me something and I'm trying to get to the next patient because stress in the system and all that. So I knew I didn't want to do that as soon as I was done with training. So I did have, again, with the travel doctoring, I worked at a few clinics and did a little bit of we'll call it like corporate medicine. But ultimately, this is where my heart is being able to kind of take it back to the old timey doctor who actually gets to know people and even does home visits and all that kind of the real good stuff.
Oh my goodness. That is so refreshing to hear to hear you share that, because it's not assembly line. It's personalized
Oh,
patient care, which we all crave. And, I'm hearing a different perspective because from a physician, you want that also.
yes. And
And
I'll tell you something, ask any primary doc and they're like, I want that. Like, that is why this is going to have to go that direction, because patients hate it and doctors hate what's happening right now. Like, nobody got into this be like, yeah, 15 minutes, like, see you later. Nah, nah,
because we're all unique,
crazy.
we're all different, we have
Mm-hmm.
different needs. And I love the way you have a heart for wanting to really get to know your patients and understand what's going on in their life so that you can better assess how to support them, how to treat them, how to help them be better, right?
Yeah,
Oh my goodness.
for
Okay,
sure.
so let's back up a little bit. For
Yes,
those
sorry.
who
I
are
get so
hearing this
excited.
for the first time, and how would you simply explain direct primary care and why is it such a game changer? So let's kind of circle it
Sure.
back in regards to how it affects entrepreneurs.
Sure. So direct primary care is a model of healthcare that does not take insurance and instead does a monthly subscription fee. So that is fantastic for entrepreneurs, because out of pocket insurance is crazy. It's unaffordable for most people. When you're starting your business, you are counting every single cent and allocating where it goes to. And unfortunately, when you're generally a healthy person, you're like, I don't need to take care of my health. It costs too much to have insurance. So direct primary care fills that need because instead of a $600 premium for the one person, because you can't get, you can't jump into a company that you're being paid by and get the benefit of lots of people. So instead of that high amount per month, you can get a catastrophic insurance coverage, because unfortunately we all still need coverage for the emergency department, hospitalizations, things we can't predict. But with that baseline catastrophic coverage, entrepreneurs and small business owners can pay. My fee is $150 a month, but generally around here, that's pretty much middle of the road, if not like on the lower end. It's usually around like 150 to 175. And if you think about that throughout the year, that's 1,800 a year for full primary care. And that to me is like, because I heard it put this way, and this stabbed me right in the heart. We're all one hospitalization away from bankruptcy, which is terrifying.
That's sobering, isn't it?
It's so sobering. So if you have a doctor, a direct primary care doctor that you can text directly, that can keep you out of the urgent care, that can keep you out of the emergency department, that saves hundreds at least, and at most tens of thousands. So, and I've got an example. I don't know if you want me to go into it at this point, but I have an example of kind of how this can snowball and how it can be prevented with.
No, go for it.
So one of my favorite examples is UTIs, urinary tract infections. I also have a similar one with pneumonia, but either way, we'll go with the UTIs. Usually people know when they have a urinary tract symptom. So you go to the urgent care. Let's say you don't have direct primary care. You go to the urgent care because you can't get in to see your primary doctor for 3 months, if you even have insurance to be able to see a primary doc. So you go to urgent care, you get the urinalysis, you get a urine culture, they give you antibiotics. Depending on what grows in the urine, that antibiotic might not work. So they usually say, follow up with your primary doc. They'll get the results eventually that say, okay, this antibiotic is going to work for this bacteria that's in your urine. But if it's the wrong one and no one contacts that patient to then say, okay, you got to come back in and get a different antibiotic, that person could end up with a kidney infection. And what happens in a kidney infection? You have to go to the emergency department. If that kidney infection then goes to the rest of your body and you get bacteria in your blood, you're looking at a very serious illness that could end up being life-threatening, and you're in the hospital. So all of a sudden we had one thing that you could have texted your direct primary care and been like, hey, I have this problem. The direct primary follows up on it and texts you back and says, hey, different antibiotic. Let's prevent this from getting worse. And then all of a sudden you've saved tens of thousands for one small urgent care visit, which it's crazy. Similar with you have a cough and you get the flu. And then sometimes if you're unlucky or just, your body does this or goes this way, you get pneumonia, bacterial pneumonia on top of that, and then end up in the hospital. Those things can be treated early. And so instead of waiting 3 months, being like, I still have this cough and I'm getting worse and I have to go to the hospital now, you could just text your direct primary care doc and get it taken care of. And it saves so much time, so much money, and so much health, because to be able to do your business, you have to be healthy. And so that's my big example.
No, thanks for bringing it home.
I get so passionate about it.
Yeah, no, I can tell. And thanks for bringing it home for entrepreneurs, because time is money. And, we're solopreneurs in many cases, entrepreneurs, small business owners. Staying healthy is important for all of us.
Yes.
But when you have your own business, it's very important, And what I love that you shared so many things that touch my heart that, really talking about your heart that I, really can feel is healthcare versus sick care. And to have an advocate, have a resource, have somebody who can take a look at my individual situation or your individual situation and assess it and keep us, and your examples are great because you're keeping the patient from having to experience symptoms that are going to be, more severe and also keep you out of the hospital.
Hmm. Yeah,
So,
exactly.
all very important. So let's, kind of moving on here. What are some of the biggest frustrations that people experience in traditional healthcare that direct primary care is designed to solve? And you talked about a little bit about it, but take us to the next level here.
Sure. By and large, access to care. That is the largest problem that is facing at least us here in Washington. It really depends on the area, but in this area, in this state, it is nearly impossible to get in to see a doctor. So if you're already established with a clinic, 3 months to get a regular appointment. If you're not established, and I see everybody being like, yep, because we've all tried it. Like even I, as soon as I learned about direct primary care, I like got one for me because I was like, I'm not ever doing that where I have to wait that long. It's crazy. So you either are seeing someone in 3 months or 6 months if you're a new patient, and usually we're establishing care because something has come up that we're like, oh, I should see a doctor. So if you have a problem today and 3 months is the earliest appointment you can get, what's going to happen in that time? So it's really access to care. It's faster access. It's longer appointments. So I do an hour, but most primary docs will do over 30 minutes. It just depends on how much of a talker they are really, and how much, you know, how long they feel they need to take care of patients. But I have not heard of any that are under 30 minutes. They're usually an hour-long appointment. So you get more time with your doctor. You get to see them faster, which are hugely, hugely important. And I think probably the most important point of access is directly texting your doctor, directly messaging your doctor, right? Like there's a doctor in your pocket now when you have this model of care, because we've all experienced when you have the traditional model where it's a large corporation. And I won't even say like private practice, because some private practices, even though they take insurance, are easier to communicate with. But if you're going for like a large corporately run system where they have multiple clinics, like you call a calling center to get an appointment, you send a my chart message and it gets seen by somebody. I don't know who it is, but they answer it to the best of their ability. So if it gets sent to a medical assistant or an LPN or a nurse, like an RN, then they're answering to the best of their ability. And it's not always getting sent to the doctor as you're presenting it. So if you have a question, you usually have to wait a few days to get an answer to that. If it's urgent, yeah, they get back to you as quickly as they can, but it also might not be your doctor. It might be one of the other ones in that clinic because everybody takes different call. So direct primary care essentially eliminates that entire problem of not having access to your doctor. Like even if we take cost out of it and everything else, like just being able to talk to a doctor without having to wait and without having to go through multiple people is hugely important. And that I just do not see any other way that this healthcare system is going to go than like having more direct primaries around.
Yeah, it doesn't seem to be sustainable. And I think we're coming to a point where, and it's refreshing to hear a doctor have that same perspective because I really haven't had an opportunity to have a conversation like this where
Yeah.
we hear your perspective in your heart. So thank you for sharing that because that's so refreshing. But I can attest to your story. I mean, I didn't necessarily have anything going on, but I felt like, gosh, I haven't had, a well checkup for a while. I should make an appointment. And so I went and I made an appointment. Because of COVID, the doctor that I had was no longer, she had retired. And
Yeah.
so I actually had to get a whole new doctor. And so that put me out 6+ months, your story, just to testify that. And then get this, 2 weeks before my appointment, because I had to wait, I think it was 8 months actually. I had to wait 8 months. And 2 weeks before my appointment, I got a letter and a text that the doctor that they had signed to me was retiring on the day I had my appointment. So I called and I'm like, okay, I get it. So I have an appointment that day. I get it that I couldn't see her the next day, but why couldn't I have my appointment that has been on the books for
Yeah.
8 months? And they said, no, sorry, she's not available. They made an appointment 6 months out,
Oh, another 6 months?
another 6 months out. So I'm going to see her this month, April, somebody.
Yeah.
In the meantime, I have a naturopath
Yeah.
that I have been seeing, but I pay for insurance.
Yeah.
So I thought, well, I'll get my blood work,
Mm-hmm.
I'll get just a basic checkup. I wasn't expecting to
Yeah.
get, frankly, and I hate to say this, a lot out of it, but I pay into it. So I wanted to have that basic baseline available to me and
Yeah.
be able to, if nothing else, get my blood work and be able to have a doctor so that if there is a challenge, that I do have somebody that I can access.
Yep.
And I'm fortunate that my naturopath, I do have her direct number.
Yeah.
And I have reached out to her at times and been able to get information from her. So, that's
Good.
a real life situation, a story to, kind of underline what you're sharing, that it does happen and the system is not very flexible.
No, it's really not flexible. And to address the annual visits, which are hugely important, if you're trying to get an annual visit or just like established care, insurance dictates that you could, if you want that fully covered by insurance, you have to only do preventive care. You can't ask questions outside of that. So if you're waiting a year to see somebody and then you can't even ask the questions that you have, and you've waited a year because of scheduling conflicts on their end, and let's say you're due for a pap smear or a mammogram or something where, or even lab work where it's something that's like, we need to check this at certain time intervals, and that could have prevented chronic disease or cancer, then that's a big freaking deal,
Yeah.
right? Like that is like, I mean, just to go off on the side tangent of like pap smears, like if you're getting those and you're preventing cervical cancer and someone's going from like a low level, like cellular dysplasia, and that year leads them to more problems, that's a way bigger situation. So it's like it's almost shameful how bad, and there's no, I don't even know where to put the blame, but it's so bad how it's gotten to the point that like you got a just regular people, we can't get in to see the doctor for a year. That's crazy.
And not everybody has that situation. I mean, that's my personal testimonial. I shared after hearing, the general
Yeah.
one that occurs just because I know that's true because I've
Yeah.
experienced it myself. And not to, diminish the traditional medical system because there's a lot of doctors that really care. There's a lot of practices they're
Mhm.
very good and very
Yeah.
supportive. We're really wanting to focus here on, the opportunity for, to learn more about direct
Something different.
primary
I'm sorry.
care.
I got too up
No,
on
no,
my
no, no, no. I just,
high
I
horse.
just want to, for those, for you who are listening, who want to learn more, who are very interested in being able to hear a perspective from a doctor that has, been in the system and wants to create a better experience for their patients. Um, that's who we're talking to. And then also entrepreneurs and being able to, kind of weave in all these little subtleties. Like, you and I in our conversation, we talked about the importance of lifestyle medicine.
Mm-hmm.
And you talked about two foundational habits that can make the biggest difference for busy business owners. So can we talk about that a little bit?
Yes. So lifestyle medicine. Oh, I love this. It's so exciting. It's evidence-based. It's an evidence-based like field of medicine that's basically how do you live healthier to prevent disease and in some cases to help treat it. It in of itself, it's not like, it doesn't replace medicine, but it helps so much to, number one, live a happier life. A lot of lifestyle medicine focuses on stress management, restful sleep, connectedness, like social connectedness. Those are three of the pillars of it. And those are massively important for entrepreneurs, business owners, people who are leading other people. So there's this whole field that I've specifically gone to the conferences for and debating on if I want to get that board certification. But there are doctors out here who are doing this training, and it's so cool because it gets at looking at the person in front of you. How do you explain to them, like, basically the how do I put this? Um, how do you adjust your lifestyle to fit your needs so that you can be healthier and lead better? So, for example, I'll give you the example of like exercise and just like healthy eating. If a doctor were to tell me, Dr. Jess, that I need to exercise an hour a day by running a mile or however many miles it would take to make an hour, I don't know, I would say, you're nuts, and I'm not doing that. And I would just turn on my brain and be like, I'm not listening to this anymore. So, lifestyle medicine takes that like exercise and eat well and dives into it and says, like, okay, what's actually going to work? And how do you apply it to your life, to your patients' lives, so that it's actually something they'll do and something they'll change? Because think about yourself as a business owner. How would you feel if your happiness level increased, your sleep was better, you had good connections with other entrepreneurs, you had good connections with your staff, with your clients? How would you feel if you, like, hey, like, I know how to eat healthy, I know what exercise works for me, and then I know that I'm doing things for my health long term, and putting this into place so that I'm not just an entrepreneur and a business owner now, I'm an entrepreneur and a business owner 20 years from now. My company has grown exponentially because I have a good foundation and I'm healthy. I'm the healthiest I can be. So that's what like lifestyle medicine is, and that's why I'm so excited about it. And combine that with direct primary care where you have like the doctor in your pocket. Like, that's crazy. We could all be healthier. Like, huh,
And
we
we
solved
all
it.
need those reminders to drink more water, to exercise, to get more sleep. In fact, I have to tell you, I went to bed at midnight last night, and I don't sleep very well when I go to bed later, when I go to bed after 10:30. And I'm laying there thinking, why did I stay up? I should have just gone to bed at 10:30 and woke up at 6. So we need that reinforcement that, we don't have to have a prescription for something like sleep or water. We just need gentle reminders that those are important. All of our bodies need that. And then tailor whatever else we need, with the expertise of the doctor and the guidance and the support of the doctor. So I love your focus on lifestyle medicine, your passion for it. Um, as entrepreneurs, we often put ourselves last, and maybe it's a mom thing too, a female thing. But what are some early warning signs that someone's health is being neglected, even if they feel fine? Can we go there?
Yeah. Ooh, that is a good question. Um, because it will look, again, everybody's different. It'll look different for everybody. Um, One of the biggest things I see, to just kind of give, I can't even give like a real general thing, but I can give several examples. So, one of the things I see quite frequently is fatigue and weight gain, especially around, we'll say, because I think it's probably mostly women on this podcast. It's all women on the podcast and maybe listening. Um, Around the time of perimenopause and menopause. And we like to just kind of blame, you know, the body changes. But those could also be signs of stress, of chronic stress. And as business owners, as entrepreneurs, we know that stress is happening. It's happening all the time, even if it's like tiny amounts of stress, like chronically. And then you're over time your cortisol is just kind of staying at this high level, and you just kind of feel icky or you feel really tired. And so those are signs that maybe it's time to see somebody, because those can also be signs of other medical problems. And so to parse through that, you really need a guide. You need a primary doc. You need somebody who's going to listen, like you see a naturopath, Cyndi. Like you need somebody who's going to bounce this off you and say, oh, okay, like maybe it's this, or maybe it's, maybe it's stress, or maybe it's this disease that's brewing. So paying attention to how you feel, like if you're feeling rested, a lot of it is really just kind of the paying attention to the body that you're in. If you're feeling achy, if you're having periods that are really, really painful, these things are like, not all of those things are normal. Headaches to a certain extent, they really, like, there's small things that could be signs of something bigger, or it could just be like chronically stressed because stress happens to all of us. So hard to say, like it's almost not even like, when should I see a doctor, when should I see care? It's more, everyone with a body and a brain should have a primary doc, should have some reputable guide that can help them for when these things come up, and to reflect back and say, hey, I've noticed that after seeing you for several times, this has changed. And so sometimes when we put our health on the back burner, we're like, oh, I'm just going to ignore that thing until it gets so bad. Seeing somebody every year, it's almost like taking your car in for regular maintenance. Like, let's get the oil changed before something bad happens. Like, let's go in and talk to somebody.
That's funny because we can relate to that. You're blowing an engine or something.
Yes,
We don't
like,
always think about it for ourselves, blowing a gasket,
yes,
having a heart attack, um,
yes, like having the
having a
light come
stroke.
on, the check engine
Right.
light for your body.
Right, right. Well, what lands for me as I'm hearing you share is it's really we're experiencing so many paradigm shifts in our culture right now. In the healthcare arena, even in business and commerce and government and religion. It's just there's so many areas that are experiencing an awakening and a shi and different shifts. I think for myself, I see it as being more in tune with my body and
Mhm.
not delegating like my health to somebody else to oversee, but paying attention to those things like you said, like weight gain and the cortisol spikes and the my adrenals being, taxed. Am I getting enough sleep? Am I drinking enough water? What is my weight situation? Taking personal responsibility and having somebody that I can share my concerns with somebody who will listen and has more time for that, I think is huge. So I
That's the
appreciate
perfect marriage of both things.
it is because we have to take responsibility for our own health first and foremost, and then seek out somebody who will listen, who has the time, and seeking out another model, which is, we're not used to that model. We're not
Yeah.
used to the wellness model. We're used to the sick care model.
Mhm.
So there's a lot of things to consider. Okay, so what shifts someone from, being in a more reactive care mode to proactive and relationship-based care, which we've talked about with lifestyle medicine, right?
Yep. Um, and which you essentially just like said beautifully, is being aware, and um aware of what's happening in your own body, and willing to talk to somebody about it, willing to say, this is different. So noticing that something's different and then acting on that in order to change it. And I'll say body and mind, because a lot of us
Mm.
kind of just say, oh, like, I'm just anxious, I'm just this, I'm just that, like, it's fine, this is just how I am. Well, maybe let's like take a little breather and see, okay, how am I actually feeling? What's going on in my head? Like, do I need to talk to somebody? And then taking that step. So that's the kind of the proactive part, is paying attention to this body and mind that we all have, and then seeking that connection with someone who's going to listen. That's hugely important. So that's the kind of, instead of the reactive would be like we just said, like, oh, I have this like weird mole, but I'm just going to wait. I'm just going to wait and I'll get it taken care of later, 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 later. And then later comes, and either you can't get in a timely manner, or it's something big and bad and scary that we could have taken up a while ago. So it's really putting it on yourself to say, okay, I do need to seek care, and I deserve to seek care. Which again, as business owners, we're like, oh no, I'm the boss. I got to take on everything. I'll just push it down. Nope, we deserve it. And it's okay to seek care. And it's okay to say like something's different. And if you don't feel like you're being heard, to find somebody who is hearing you, to get a second opinion within whatever sphere it is. So if you're saying like, okay, I want to do direct primary care because I want a doctor that listens, there's like a handful at least within the northern Seattle area. So there's options. So it's all about like you said, like self-reflection plus finding that partnership.
Yes. And making the giving yourself permission to make an investment in yourself.
Yes.
And part of that is to choose wisely who is going to be your caretaker.
Mm-hmm. Mm-hmm.
We have the autonomy to do that. And that's a different paradigm, because I'm thinking about like, oh, I don't know, the 80s, whatever, there was a time, maybe I'm getting the timing wrong, 70s, 80s, whatever, when people were depressed, and so they give them Prozac. And so I think we're beyond that now. We're like, okay, what can I do to get to the root cause of what's going on with my health? I know that's true for myself. I don't, everybody's different, but for me, and I don't, if anybody can relate to that, I want to get to the root cause. I don't want to put a band-aid on things. I want to find out what's really going on with my body. It may take longer for me to feel better, but I'm willing to be on that journey and get to the root cause of the situation, and then, and be able to, um, you know, put the your financial um, allocation, your time allocation, whatever, to get to that end.
Mm-hmm. Yeah. And to that point, like finding the like root cause, your doctor should be able to help you with that. And that's where it's like you don't have to go through that alone, right? Like you can, like, I can't speak to the 80s. I was a baby.
Right.
um but yeah, right now in what we have available here, you can find a provider, especially in this model of care, in direct primary care, who will listen and will help you to find for you what is the thing that's causing whatever ailment it is, whether it's depression and you do need medication to help balance brain chemistry, or is it something like anxiety where the gold standard treatment is therapy along with possibly medication, or is it something that's not even those and it's like something else that's looking like anxiety, because there's things that can masquerade as other health problems. And if you don't know, like, of course, why would you know if you like didn't go to medical training and all that stuff? So it's super important, like you're saying, to find somebody who's going to listen and help you, like help guide you through this or whatever thing it is. And finding a reputable guide who's going to listen to you. Like, I think that's the main takeaway here, is the time that doctors are able to spend with patients is the thing that is going to change in the future. Like, it has to change for the better. And now you're right, there's more options available so that we can have that time, because 15-minute appointments, it's almost impossible as a patient to say like what's going on. And as a doctor to hear really what's going on. And honestly, to my colleagues who are doing this, like, work in corporate medicine and are seeing 20 patients a day, 25 patients a day, like, I know that the people I went to training with are well trained, and I am astounded that they are able to be good physicians in the situation that they are in. Like, power to them, because I myself, like, I can't do it. I need to be able to hear what people are saying, and I need to be able to talk to them for longer. And maybe I'm just slow. Maybe I'm just a slow doctor.
Well, I don't,
Time
you
wise,
know,
not in my brain.
whether you're fast or slow, it's really the issue is, do you have time to care for your patient? It's not, what we've learned is each person is unique and has unique things that are going on in their body. And we deserve to be treated individually, not have a cookie cutter situation. I don't like being treated like, you're just a body. There's a female body and there's a male body. There's a 68-year-old woman's body and it's my body, and my body
Yeah.
has unique needs. And, it's refreshing to have my needs met or investigated.
Yeah.
It's again, I want to be careful here because there's a lot of physicians and organizations that are, care about their clients and then are
Absolutely.
doing good in the community. The model itself, and I can say this, I don't want to get you in trouble, but I don't think the model is sustainable. And so that's
I
what we're
agree
kind
with
of
you.
alluding to here is let's talk about this. What is a sustainable model? Whether it's 15 minutes or an hour, you know, I'm sure the doctors that are seeing patients for 15 doesn't mean they don't care. It just means they don't have the time to listen. They don't have the time to ask questions. And so it's not that they're wrong or bad, it's the model is not sustainable. And
Yes,
so that's what
I
we're
agree with
alluding
you.
here to. We're not trying to throw out the baby with the bathwater. We're just trying to have an open conversation. And it's so refreshing to have it with a physician that you have your foot in both worlds and you want to create a solution so that your patients can be heard, their needs can be met, they're not treated like, a number, they're a person, and be able to, navigate this situation, in a way that is a human, you know what I mean?
Yeah.
It's
It
with humanity.
humanizes medicine. And I agree with you 1,000%, Cyndi. And hopefully I know I get real passionate and uppity, but hopefully any physicians listening to this know that I'm with you, and like, I want to show you the lifeline. Like, I know that physicians care unbelievably deeply about patients. And it really is a problem with the system. I don't know how we got here. I don't know the way to break down the system other than getting out to a different model of care. Because you're right, like, doctors care so deeply about their patients, and no one wants to have a 15-minute like visit where they're
Right.
just using their brain like an algorithm, like, okay, go, 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 go. No, like, primary care docs, we're squishy on the inside. We like to have conversations.
Well, it starts with a conversation, and we're having that conversation right now. Are we solving the problems of the world? No, but being able to talk about it and be able to explore it, creating new models like what you're doing with the direct primary care, carving out more time for your patients, being able to have more access to you and your expertise so that things don't have to get out of control so they can be caught earlier. Those are all so important. So, what's the legacy or impact? I mean, you've talked about this already, but let's just put a bow around this before we open it up for questions from those who are listening. What's the legacy or impact that you personally hope to create through Lucido Family Medicine and what you're working on right now? Because I think it's such a beautiful model.
I love this question so much. So like, if we look, let's say 30 years into the future, I'll be winding down my practice, my specific practice at that time. But I would love to see multiple clinics that Lucido opens, each one having multiple providers in it. Because a lot of people who come into this model, I'd say about half and half have insurance and half don't. But either way, all of those patients now have access to their doctor and they are healthier. And then because they're healthier, their employees are healthier, their children are healthier, their siblings, because they've spread this like, hey, there's this other way, and we can all take control of our health and have a doctor that is actually like, we're all on the same team. And so if I picture, 30 years from now, there's more direct primary care practices than there are like corporate based primary care practices. Ideally, there would be a shift. I know the American Academy of Family Physician is working on this, like lobbying for better reimbursements for primary care from insurance companies, more support for independent practices such as direct primary care. And so ideally in the future, there will be an abundance of choices of direct primary care practices with competitive pricing because there will be so many. And so you can choose your doctor. So your children and your children's children can choose their doctor, choose the best fit for them, and have a good partnership and a healthy life. Because at the end of the day, we're all going the same direction. Nobody gets out of here alive. It's the quality that we have here. And so if you can find a partner in health and feel better in your life and feel healthier and be healthier, that's the ultimate goal. So I would love to see multiple practices of Lucido Family Medicine alongside other direct primary cares and integrating in the community. Because another aspect of what can happen with direct primary care is because we have time, I can go out into the community and do more service for the community because I'm not burnt out from having 15-minute visits of 25 patients a day. So I can go and do like lifestyle medicine talks and courses and free things that can reach more people. So that's the goal, is that it starts with like a little ripple, like this is the first, but then it just like spreads. And this could be so cool. I'm just so excited.
Mm. I love you taking us back to the future, right? You're looking at things from the perspective of you've built your career, you've built, multiple satellites for Lucida Family Medicine, and that you've brought on other physicians who are like-minded, and it's so encouraging and so uplifting. And as you mentioned, we had a beautiful talk. We were able to share very without I shared my health history with you, and I had to stop myself a couple times and say, Cyndi, you're talking to a doctor. You're talking to a doctor. And because yeah, I have to be careful. But you were very open, non-judgmental. I really appreciate that about you. I appreciate you taking a look at the model. Again, it's not throwing out the baby with the bathwater. It's being able to create a sustainable model that's going to serve humanity, that's going to serve real people. And we need to explore that. So thank you so much for this conversation. This is just really beautiful. Before we open the lines, and so prepare your questions if you have anything you want to share in terms of our conversation, entering into it. Love to have you be a part of it. But I want to make sure that people know how to get a hold of you, how to
Oh, yeah.
learn more about your practice and how to connect with you.
Cool. Thank you. So first, thank you so much for having me on this podcast. The more people that hear about this model of care, the better, right? And so if you're listening to me and you're like, that's not a good fit, but direct primary care, like, heck yes, please find yourself a direct primary doc. And Cyndi, thank you for sharing your health story with me. That is one of the most important things to me, is to hear people's stories. So I very much appreciate that. People can find me on lucidofamilymedicine.com. You can sign up as a new patient on the website. There's a lot of information on there. There's pricing, there's information about home visits, there's more of my bio and our location, and also about our healthcare partners. So in my clinic, because I like to believe in a little bit of magic, we have a Reiki practitioner, two Reiki practitioners, and an acupuncturist here. So just adjunct things that cause no harm, but really help people to go from like stressed to relaxed. So there's more information about that on our website. You can text me. I will. Do you want me to give you the phone number, like just in the links and all that?
Sure, it's up to you. You're
Okay.
welcome to if
Sure.
go ahead and share that. Be
Yeah.
prepared
So
for lots of
yeah,
text
I'll
messages.
share it. And off the top of my head, it's 360-564-1595. You can text that. It goes right to me. So anytime you call or text, I would suggest texting because sometimes the call system I uses, it doesn't ring as quickly as I would like it to. But if you leave a message, I will get back to you. If you text, then we can do that. I also do complimentary meet and greets. So if you're hearing this and you're like, that kind of sounds good, but I'm not sure how it would work for my family, or I mostly see adults, but I also will see teens and about 10 years old and up, depending, like case by case basis. So if you have a question about that, like please reach out to me. We can do a meet and greet. You can come see the office. You can ask me questions virtually. I'm happy to answer any questions because I'm really excited about this model and I want more people to know about it. So yeah, I'm available by any of the ways.
Awesome. Can you give that number again? Because you read that quickly. 360.
Right. Yep, 360-564-1595.
Okay, I'll include that in the description. And also, again, the lucidofamilymedicine.com. That's
Yep.
Lucido Family Medicine.
Yep.
And thank you, Dr. Jess. This has been
Thank you
so
so much.
much fun. And so feel free to unmute yourself. We have a few minutes if you want to comment on the conversation or you have any questions for Dr. Jess. This is a great opportunity. So,
Thank you for joining.
Lori and then Gail.
Thank you so much. It was so wonderful to hear all those things. And because of my age, I've seen the healthcare system change. And I noticed as a senior person, one thing you said is that you're in charge of your healthcare, and I don't feel that way.
Mm.
I go in, and if I don't do these, then I don't get credit or whatever. And so if we have things that we don't necessarily want to do, that's not honored because now we must. And so I love the idea that you say, I work with you to see what you want because you're in charge of your healthcare. And really, I believe that I should be in charge of my own healthcare. And so that really spoke to me. And I love this kind of model. And I just think all the years I was a single mom and I had no insurance, was, working so hard, something like this would have been so beneficial because it is affordable. And so I went without and had to stay really healthy, but always that fear. What if the thing happens? So I love this model. And thank you so much for sharing. And you just explained it so well. I love it. I want to tell everyone about it.
Awesome. Thank you for being here, Lori. I appreciate it.
Gail.
I agree with Lori. You explained it very, very well, and you did a great job of going that and being able to spend time to find out what the person actually needs or wants in their health care is such a good thing to do. I did have a couple of questions that kept going through my mind as I was going through this. I'm thinking, this sounds like it would really be a great thing, but what happens when you need specialty care, like a neurologist, a cardiologist, a foot doctor? What happens when those kind of specialty needs come up?
Yes. Beautiful question. And this is hugely important because not everybody, but eventually most people will need to see a specialist. So I refer to the patient's like choice. So basically around here, I use Skagit Valley, but if you're closer to Everett, I can refer there, but I refer to specialists when it's needed.
Okay.
I know when something is outside of my scope, and so I send to a specialist at that point. If, for example, it's one of the specialties that are hard to get into, so let's say rheumatology and endocrinology are typically almost a year out sometimes. I've got specialist support on my end that I do electronically, and I can ask a specialist my question and send the chart and say, hey, what are the first steps to this problem? Or what are the labs I should order? What medications should we start, if any? And so I have that extra support that I pay for through Lucido Family Medicine. It's at no cost to the patient. And that just is basically more support for me because it makes me feel like I'm doing safer medicine, and it helps prevent those like, do we really need to see a specialist versus like, no, you need a specialist, but they're not seeing people right now. So it gets that kind of like first step. So good question. And again, that's why unfortunately insurance coverage is necessary in some cases because specialist support.
Yep. Okay. Thank you so much.
That sounds like a really important bridge too. Because like you say, if they're, 6 months out plus for an appointment with a specialist, you can be supporting them, with the care that they're going to be needing before they see that specialist.
It's a really cool service, and I'm so glad that actually my direct primary care doc told me about it because she uses this service, and it's an online service, and they have every specialty that you could possibly think of, and so it's really cool because that includes everything from like pediatric foot doctor to like adult cardiologist and everything in between. It's super cool. I also work with a psychiatrist. I'm sorry, I don't mean to. I get so jazzed when I'm talking. I work with a psychiatrist who I meet with regularly, and she helps me go through all of my cases that are mental health cases that are not like bread and butter cases that I basically have more support from her, which is so helpful because a lot of those medications, if you've ever been on them, are like trial and error. And so having that guide for me is great because it's really hard to find a psychiatrist. It's hard to get into some specialists again. So she's kind of outside of that other system, but yeah, I've got specialist support up the wazoo.
That's awesome. We appreciate that. I appreciate your being conscientious. Kathy.
Hi, Dr. Jess.
Hi, Kathy.
Being in the industry that I am in, I get very, very frustrated, just like, you, the 15-minute visits and that kind of thing. My clients are always coming to me, and it's like a nightmare. You're a senior and you're 80 years old now, you need a specialist. You don't have time to wait for one thing, and you don't have time to even get a clear idea, they don't, with 15 minutes. And unfortunately, it is a lot of corporate control. But anyway, and I do tell my clients always, you have to be proactive in your own care anymore. But my question is also, do you work with then Medicaid people? Or, I mean, do you have like, you said 10 years, 10 and up, but what about Medicaid and those kinds of people?
So I don't take Medicaid or Medicare. So any of my costs are out of pocket. Age-wise, I will see anything 10 and up. It's not a problem for me to see like any individual person. But if it's someone who has Medicare or Medicaid and they don't have the means to pay out of pocket, that's a population that I would like to be able to serve in the future. But right now, unfortunately, it's not in my.
So you're fee-based only, basically.
Yeah, I'm fee-based only. I do have some people who have Medicare and will see me on top of that. But
do you have a conflict with that and the other providers then? Because if they've got Medicare, there are certain rules that you can't, you have to, see these doctors or they got to accept Medicare or whatever. For you, I would assume they pay the fee, see you for their primary, but then what happens if you, send them down to a specialist or whatever? Is that specialist then going to take them?
That is a really good question, and it is on an individual basis. So, for example, you're essentially hitting on the type of insurance that people have. If they have a PPO or EPO, then I can send the referral as someone who's like essentially out of network.
Right.
Some insurances want you to stay within the network of your primary person that
Your
they
HMO.
Yep, your HMOs. So direct primary care is not compatible with HMO, but you may be able to call and say, hey, I want this person listed as my primary doc. And they might be able to switch that. I haven't come across it yet if anyone's had like rules of like, oh, you can have this as your primary doc, but you have to refer to this person. Usually I ask patients to say like, okay, call your insurance and see which place takes your insurance for a specialist, and I will send the referral there. But you're hitting on like HMOs or
Yeah, you're so basically you're like a naturopath, you know. I mean, not in what you do, but how your practice works. Because a naturopath, if a like a carrier doesn't cover naturopath anymore, you know, they have to actually work with an MD that is with that carrier and go through all the hoopla. So, but a naturopath can't directly be their primary or any of that.
yeah. So yeah, very similar to that is in that if the insurance company doesn't recognize Dr. Cicoria as your primary doc, then that referral you have to like go through all the hoops. But again, they might change it depending on the insurance. Because I'm a family physician and like allopathic trained, they might do that, but it just depends.
So your demographic is really under 65 then.
Um,
If
it
they,
really just depends. Yeah, I have several patients who are over 65.
right. But they're on
That
supplements, probably Medigap policies and that kind of stuff.
yeah, or HSAs if someone has a robust HSA, because you can pay for direct primary care out of an HSA.
I'd love to see the Medicare system open, you know, open up and get rid of the corporation clinics and that kind of thing.
I know. Let's keep our fingers crossed, Kathy, and
Yeah,
hopefully,
yeah. So
yeah.
of course, you and I'd like to. We still need to set a meetup, but anyway, that was my questions because my Medicare market, my and Medicaid are
Yes.
the majors that I deal with, and you
Mhm.
know, I don't want to, you know, complicate their lives anymore for something that may not be
Right.
yet available. Really,
Yeah. Yeah. And it could be so if you have clients that are on Medicare or Medicaid and um that person wants like a one-time visit. I've had that before where people will come in and just pay for a one-time visit, like um which is not the monthly fee, it's 185 at this point, but you know, for a second opinion or just to like learn about lifestyle things, like some people will come and see me just for that too.
yeah, yeah. I think that where we really need to start is very, very, you know, getting to the parents of young people and teaching them how to eat and how to exercise, you know, how to
Yes, yes,
participate in sports and how to do things that,
yes.
you know, it doesn't have to be real physical, but we really definitely need to start with our children.
Yes, helping the next generation
They
improve.
need home ec again.
Yeah, home ec again. I'm
Yeah.
actually working with a registered dietitian who's in Arlington. Jamie Clayton is her name, and so we're looking through Stille Valley Health Connections. I don't know if you guys are familiar with that, but it's in Marysville, and they have like a teaching kitchen. So we were going to hopefully I gotta call them. So if anyone from there is listening, I'm gonna call you, and we're gonna set up like teaching classes that are going to be for free, where people can learn about nutrition. So that'll
I
be it.
know an excellent nutritionist who loves to cook, who's retired, and
Oh,
she
okay.
hooked you guys up. No, I
Yes,
mean
please do.
she still does. She still does it, but
Okay,
she like, I'll
cool.
have to hook you up.
Yes, please. I would love to. Any connections,
Yeah.
hence Exceptional Connections podcast. Thank you.
Wow, what a fun conversation this has been. Thank you again so much, Dr. Jess. You are a breath of fresh air, And at Exceptional Connections, we believe that relationships are king and health is paramount. And thank you for just shining the light and helping us as entrepreneurs be our best self. And it's encouraging to know that there's doctors like you and the direct care model that can be able to serve the community, better. And the communication piece is so important. So thank you for the work that you're doing. Thank you for taking time to be on this call with us. I just want to encourage everyone to remember to make every connection an exceptional connection. So signing off and thank you so much.
Thank you, Cyndi.
Bye. Bye, everyone. Thank you for
Everybody.
listening. Thank you for joining us.